Hi, my name's Patricia Ercolino. I'm the producer of a show called Sojourners Along the Way. And today I'm very excited about the guest that I have to introduce to you. She's a woman that I love to sit at her feet because she's so knowledgeable about many, many topics. Today we're going to talk about her field, which is speech-language pathologist. So this is Barb Martin. And Barb, I would like you to tell us a little bit about you. I know that you are with the Vinton School District as a speech-language pathologist at the elementary, middle, and high schools. Would you tell us how that came about? What kind of degrees do you have? Tell us a little bit about your background, please.
All right. I got my bachelor's degree in speech pathology at the University of Missouri in Kansas City. Then I went on to grad school on an assistantship at the University of Kansas Medical Center. And there's where I got my master's degree. Pretty much been practicing on and off for maybe 35 years, doing some other jobs, you know, in between. I started out working in a health department, and my second job was a school for the blind, which was totally an interesting place. And sort of never really wanted to work in the schools, always wanted to be in a clinical setting. So I worked some in some hospitals. I worked in nursing homes. I've done private practice in Kansas City. Later on, of course, I became a school principal in town here of a private school. And I worked at my husband's counseling center, Wellspring Retreat and Resource Center, doing sort of educative workshops. I'm not a licensed counselor, but I did a lot of education and teaching. And I worked in Head Start for many years, on and off through the years. And then most recently, I did get into working in the schools. And I worked in the Meigs School District for 3 years, doing Head Start mostly. And currently I'm at Vinton, and I've been there 8 or 9 years, and have a huge caseload of like 75 kids. Now it's about at 65 at this point in the year. So it's been a great profession to be in. If I had the chance to do it again, I would probably go into the same field. Not all people say that.
Yeah.
Actually, they wish they would have done something else, but it's been a good profession.
Well, it sounds like. It sounds like you had a wide variety of experiences, and that's something I'm hoping that we'll be able to share today to help the parents, and help not just the parents, but also any adult that has connection with young children. Because speech is so important, and being able to be understood. There are a lot of children that have difficulty in that. So I'm hoping that during the course of this program, our viewing audience will get lots of ideas of how to help their children or children in their lives. So, what does a speech-language pathologist do?
Okay, just simply stated, a speech-language pathologist helps persons, individuals, who have communication difficulties. Now that's simple and just to the point, but to get the range of what this field includes, I'm going to give you some of the disorders we treat.
Okay.
Because if you're a deaf educator, you work with just deaf kids. Or in many professions, you just do podiatry, and so you work with the feet. Speech pathologists are pretty broadly based, and they see a huge variety of communication disorders, so I'm going to just mention some of them. We have cerebral palsy. We deal with kids with cerebral palsy. We deal with, well, kids, I say kids because we're talking mostly about young people, but individuals that have cleft palate. We work with autism and autistic kids. The range from those that are nonverbal all the way up to Asperger's, which is a higher functioning autism, and so they talk, and they may talk a lot, but They may be talking just about dinosaurs and everything they know about dinosaurs. There is articulation, which is the speech sound disorders. There's language delay, which is a big area because you can have many disorders and still have language delay. We work with voice disorders. Some therapists actually work with swallowing disorders that come with some children that have cerebral palsy, or of course with adults that have had strokes. There's also stuttering. A lot of young kids go through periods of stuttering. We work also on something called apraxia, which is where the brain doesn't have the ability to program a motor movement, so they really struggle to produce speech, which it's different than articulation, where the child can talk, they just can't say their sounds clearly, but they have the words. There's also something that's come up more recently, and that is traumatic brain injury through kids that are in accidents. When I was at the University of Kansas Medical Center, in my early days of training, I saw a little girl who, I think it was sort of 5 to 6, I can't remember her age, but she had been in a car accident and one whole hemisphere of her brain was sheared off. So we had to try to train the other side of the brain to pick up all the language that she would need for the rest of her life. And last year at Vinton, I worked with a traumatic injury middle school kid who had gotten meningitis or encephalitis and ended up with a lot of memory problems, just could not recall things. Learning disabilities would be the other area. There's learning disability teachers, but a speech pathologist is working with them because one of the characteristics of learning disability is that the kids, have like writing difficulties, and so we might work on constructing paragraphs. And
so writing also goes into speech
yes,
and language?
Because it is written expression. And we deal with comprehension and expression. Everything is divided into kind of those two areas. So most of the time we deal with oral expression, but kids that have oral expression problems are also not good writers because they can't formulate the thoughts in their mind. And then if you have motor problems, trying to get them on a piece of paper becomes very difficult. So that's just some of them. There's many gene related disorders, chromosome disorders that we're finding more and more and identifying. And so there's just many disorders,
How would identifying the chromosomes assist a speech-language pathologist to work with a child?
Well, our job is not diagnosis. Usually a chromosome disorder is something a doctor or a large medical center like Children's would be identifying, and what usually happens is it's a syndrome. So it has certain facial characteristics, like I dealt with Pierre-Robin syndrome. Well, it meant she had a very small mouth, and she had a recessed chin, and she had a very small tongue. So to work on clarity of speech was hard because she had this little baby mouth.
Okay.
And
what was the name of that?
Pierre-Robin
so
syndrome.
That means small.
Small mouth and kind of a small body, small head. And so different disorders have different physical characteristics, some of which may affect speech because it has to do with, like ear problems sometimes. Different kind of hearing loss is related to certain kind of syndrome. And so you have to know what the features of the syndrome are to kind of figure out. Some of them have behavioral things that characterize them. And so then sometimes you've got behavioral issues to getting them to focus. And sometimes they'll spend like 3 minutes with you and then they want to move, they want to go on to something else, and you have to realize that you've got to come up with therapy ideas for every 3 minutes.
Yeah.
You know,
That's
and so just knowing the whole characteristics of a syndrome helps you plan therapy. And then, of course, you can work in conjunction with a team of people, like at Children's, or, you know, like at Vinton, we have a PT and an OT, and so you kind of work with the team members to best focus on the kids' strengths.
Okay. The reason I wanted to ask about the chromosomes, because that is a medical condition, so I'm hoping that the doctors would inform the parents and say, this is something you should expect, let's start exploring. I personally am of the opinion that the earlier something can be caught, hopefully we could do either preventive or we can help the child right very early. What would your take on that be?
Oh, absolutely. The brain is wired for learning very early on, and so the more you intervene, you know, early, the better off you are in programming the brain to lay down in the brain all the words and all the things that needs to be taught. But I mean, that is, sometimes parents notice at first. They take it to the pediatrician, who may then refer them up to Children's for a full evaluation, which is where those kind of things are mostly picked up, unless it's a common syndrome that you know, the classic local pediatrician would, you know, pick up. And then they come back with a big evaluation from Children's. They have good recommendations for local therapists to follow through on. And so, yeah, early intervention is always key.
That sounds good. Should I jump to asking, what should parents of very young children look for that would be an indication? How young?
Well, for a couple years I worked at Help Me Grow, which is an early intervention program, which is age, well, 0 to 3, I believe. And during that time, I would go out to homes and help parents of infants and young toddlers identify where they're maybe starting to not to come on target for the developmental milestones that should be occurring at 14 months or 18 months or whatever. And I actually designed a curriculum with like bags of material that each week the service provider or the therapist could go into the home and demonstrate to the mom how to do good language stimulation. You know, kids that aren't babbling at 9 months, I mean, there's always a range at which developmentally these things come in, but you can start to see that kids are not developing or not paying attention, or they don't turn their head when their name is called, or you know, go get the ball, and then they're crawling and they don't know ball from pencil or dog or something. So you can start to see some early signs that there might be some language delay. And Help Me Grow is a good early intervention program. They send workers into the home to work with the parents. It's a very hands-on, work with the parents, teach the parents. As a specialist, I went in and would give, you know, special tips on things to do, and these different kits that I would make. You know, like a book would be with it, and a toy would be with it, and you could show the parent how to work on language. It's always important to deal first with language. I mean, speech is happening, and there are kids that learn to speak, like girls, perfectly, you know, sort of from the beginning. But what you really want is language, because you can take and change articulation. You need some motor maturity to really work on speech or articulation. You don't need motor maturity for language. You are trying to lay down words in the brain. Then when they want to say something, I want that ball, then you could work on want, get the final T, and ball, which has an L, which doesn't come in till 4. So why be focusing on, oh, my kid doesn't have an L at the end of the word ball. It doesn't come in developmentally for a while. And there's a lot of parents that get too stressed out about the clarity of speech, but when you look at it developmentally, only so many sounds, looking at a norm of huge range of kids that they've normed it on. Kids aren't saying S blends, like street, S-T and R. That comes in at age 6. So if your kid is not saying a blend, don't worry about it, you know. So the focus is on language. And kind of most of our articulation tests that try to say which sounds come in at different ages start at age 3. There's one test that starts at 2, but I mean, there's only so many sounds that really all 2-year-olds have. B would be one of them, D and M, like dada, mama, baby, or ba for bottle. So it's, most of our articulation tests start at age 3. So from 0 to 3, the whole trip is words. Building words, letting them love to talk, letting them learn to label things, you know, comprehend up, and, you know, working with simple words that you can play with your kids with toys.
Okay. Now you mentioned Help Me Grow. Where is that physically located?
Well, for me, I was working in Meg, so it was in Middleport. But I mean, there's a Help Me Grow out in the Vinton, MacArthur area where I teach. But Athens has one too. You just have to look it up. And they go out to rural homes. They'll go out to wherever you are. You don't have to have a car to get there. They'll come to your home. And if you don't want someone in your home, you can come into the center.
Okay. Because I want to give people resources.
Yeah, Help Me Grow is a great early intervention, as is Head Start. But Head Start is a preschool, so that starts at 3. You can also get preschool in the public schools. There's some fee attached to that until it's mandated, which it's not at this point. Kindergarten is mandated, preschool is not. So we have kids coming in just at kindergarten, but other kids have been going to school since age 3. But if you are, you know, struggling with income and could not afford daily sending your child to public preschool, Help Me Grow is for families that struggle more with income. Okay. And all areas have Head Start, and it's highly funded by the state, or it's a federal program, I'm saying, and every state has Head Start.
Okay.
Yeah. And so that's another good place, because they're getting preschool, they're getting words, and they send home things to parents, and the kids get exposed to all kinds of objects and play materials that they may not have in the home. So that is another good program. And you just call them and get on a waiting list.
I think perhaps 211 is an area helpline that helps people to connect to different, I don't know, facilities, programs that are in our region. In our interview with some people in the healthcare profession, they said that if you call 211, you can get connected with any of them. So I'm hoping the same will be true for Help Me Grow. That would be great.
Yeah, I don't know of 211, so.
Yeah, well,
but, you know,
I don't know how long it's been in the area,
yeah.
But it sounds like it's going to be a good resource.
I would say even Child and Family Services, some of these social service organizations would have the phone numbers of the local one, depending on where you live.
Okay, well, that's good. Want to help people to be able to connect, because the younger they can get started, the better it is for the child.
Right.
Yeah.
And I mean, the schools would say we want all kids ready to learn. That's like a mantra. The thing is, and I used to work in Head Start, so I was starting with age 3, and the kids didn't know words, they didn't have their sounds, and I thought, here, this good opportunity to build this up in the kids' brain when their brains are so wired for language learning, they were missing that. So for me, it was great to step back 2 years and say, there's a lot of things you can be doing, you know, at a younger age to get them ready for preschool, where preschool today is a bit like kindergarten for my age. Everything is moved up, up, up. Okay. And what we used to do, where I played dress-ups in kindergarten, you are writing your name and learning your words, and by the end of the kindergarten year, you're reading, and sort of the academic push has accelerated some. So kids, to be ready to learn, they need to be exposed to a lot of what we'll call pre-academic things, language being foundational.
Oh, definitely.
To everything.
I hope parents and adults that have contact with young children will see the opportunity and seize the opportunity. So I'm hoping that, you know, we will be able to give them some ideas. In fact, when I told a mom of a little toddler that I was going to be doing an interview with you, she was so excited. It was like, okay, what can I do to help my child to gain language? So I'm glad to hear about Help Me Grow, and I'm hoping that we can pull out from you more ideas to be able to help parents and again, other adults. We don't want just parents thinking they're the only ones. We don't want other adults thinking that, oh, that's the job of the parent, because should I use the phrase, it takes a whole village to raise a child. And if we look at it as a community that's coming together to help the children to grow, that would be fabulous.
You also have grandparents.
Yes, yes.
I did not know till I worked in the public schools how many grandparents are actually raising the grandkids. You know, because of problematic issues with the parents. Grandparents have gotten custody of kids, and they feel like, wow, it's been a long time since I've had to do this. But they have the great opportunity. And even when parents drop the kids off at school, that's not the end of them working with their kids. Maybe we could...
Could you say that again, please?
Always the parent, you know. And anybody who interacts with a child should be interacting with them in an educative way, without making them feel like they're in school necessarily, but, you know.
Education can be fun.
Yeah.
And we want kids to learn that learning is fun. And there's so much to learn, that there's a smorgasbord out there, and the more that we can introduce the children to, the better it is. But foundational is going to be language. Either being able to speak, read, or write. Those are key elements that we need to help the children with.
Right. Maybe now would be a good time to go into some just different ways to stimulate language.
Love it. I see your array of toys and things.
Just a few materials here. Let's first start with books, because most parents hear the word television and from other people that it's good to read books to your child. And it is. They learn many concepts. They learn the flow of a storyline. They are introduced sometimes to verbs that they don't really use in their world. I mean, go and come and hit and throw and those kind of words you might hear in the house. But in a book, you're introduced to other kind of verbs.
Okay.
And so that is good. That makes for the ability to make a sentence where you have a subject and a verb. And so it's all like builds up this ladder of language learning. So reading to your child is very important. But I don't work with normal kids most of the time. So I'm saying this, there's two levels. If your child is average or above average, and you're an educated parent, you would know to pick books that sort of fit the age level. And you would pick a book that's at their age level, if not a little above it, so that you're always stretching them. And you can read to them and interact with them. But there are kids that don't have much language, and this is what I'm going to focus on because this is more my field. And this is the book I have. I got it as a classic. It's very well known, The Little Engine That Could, and it's been around for many, many years. You're looking at a lot of text here. Now I'm talking about sitting down in bed or on the sofa with your toddler who is 2. And maybe he doesn't have the number of words that a toddler at 2 should have, which is about 50, okay? And for a 3-year-old, it's 200. So you're talking between 2 and 3, you are really adding words. So I would not even sit down with a 2-year-old that maybe has 22 words, and of those 22, it's dada and mama and important words in the environment, but not much you would find in terms of extra vocabulary that's sort of out of the average. And you're wanting them to grow in language. So you need to know the story, first of all. So as a mother, you read the book so you get the gist of the storyline. But I would open the book and say, look, we are going to read a story about, and you could look at the kid, he might say nothing. If he could say train, you might say, do you know what this is? Look at this. That's going down the tracks. It's a choo-choo train, and it's a blue choo-choo train, and we're going to read this story about the engine that could. Well, most people don't explain words. Engine? Why would a 2-year-old know engine? But people just read the story like this is all understood. It's not understood. So you would point out this is about the engine. The engine is the first part of the train. And then there's the other cars behind it. So then you would open it up and you'd look at this picture and you might say, so what do you see in that? What do you see?
Do you want me to answer?
Yeah.
Okay. And what age am I?
You are 2 with like
2.
22 words.
Oh, wow. Clown?
Okay. Which you wouldn't be saying it clown because that's a blend.
blend.
You might go cow.
Okay.
And you go, oh, that's right. That's a clown. Okay, well, let's read this story. So here's the train going down the track. Here's the grass, and we've got the trees. And there's some animals there. You know animals, like our dog Fluffy here. There's lots of animals here.
And bear?
There's bear. Good word. It's a bear. You know what these tall animals are?
No.
Giraffe. That's a giraffe.
Giraffe.
Well, you probably wouldn't say it.
Like that.
Well, good. Good try. And look how many there are. Let's count them. One, 2. That's right. There's 2 giraffes in there.
Now, by age 2, you would expect the child to be able to count 1, 2. Yes.
That's right. And so you would focus on that. And then you might say, look at their necks. You've got a neck. And they've got tall necks. And what I'm doing here is instead of reading this whole complex story to a kid who has 22 words, most of them, maybe 6 of them, are names. This big long thing about then the shiny engine snorted, he doesn't know snorted. I pull you, I'm a passenger engine. Do you realize what higher level vocabulary that is? You will not teach the non-talking child unless you simplify it and talk about the things, the pictures.
Yeah.
Get them to identify the main objects in it, ooh, look at that bright yellow thing shining behind that engine. And you would keep maybe using that word engine because you want it to be a new word. You may not necessarily care that they can say engine, but you want them to be comprehending it. So that the next time you sit down and talk about this, and it's very good to keep reading some of the same books over and over again because they get the story. And then you might even, I have gone with books where I will read a couple of the lines, like the little train rumbled over the tracks. It was a happy little train because it had all kinds of animals. You go back to picking a few of the key lines out of it so you can maybe follow the storyline. But you're looking for a few key words in here and the pictures. This way you're getting the kid to name things. Who's that? Is that a boy or a girl?
Girl.
That's a girl, and she's gone to look at the train. Somehow it looks like it stopped. I wonder what happened.
Oh.
You know what happened? So then he just shakes his head no and say, well, then we are going to turn the page and see what happened next. Oh dear, they've got another train coming along. Anyway, you go on with this. Get the story, get them to comprehend at the level they can comprehend. Adding words, adding color, adding counting, maybe pointing out smoke. Do they have to say smoke? No. Because you're going to read this book maybe every other night for a couple weeks. And they will finally, then you say, what is that? What is that coming out of that train? They might say, moke. You say, that's right, it's smoke. So that's what we call sandwiching a response. I say, what's that? That's the piece of bread. The child says, moke. And then instead of saying, right, no, you sandwich it with the word again so that the last thing the brain hears is the corrected, complete word, smoke. But you also validate them by saying, yes, that's smoke. Look at that. And then you can embellish if you want. Look, it's gray and it's going up in the sky. Ooh, isn't that interesting? That's like the smoke in our fireplace when we built our fire last night. It may be related to something in the home, something that's going on. Because we always have to tie words to experiences that the child has.
I would like to make a comment. The little engine that could. And as Barb pointed out, the language in it, the words are beyond a young child. However, use the pictures as your teaching tools. You can teach colors, you can teach objects, and again, reinforcing it and pointing out, oh, that's like our, what is something you have in your home that you can show the child from the book. And this is a great book to read for years and years with children.
That's right. Now, let me just give you another example. This is another really popular book, Alexander and the Terrible, Horrible, No Good, Very Bad Day. It has a good storyline in it. But let me just tell you, I'm going to read to you the very first page. And there's a nice line, black and white line drawing. I like pictures where you can actually see that's a chair and that is a boy and that's a teddy bear. So the pictures are nice in that. But here's the reading on this. Okay, now think you're 2 or 3 and you're snuggle with your mom listening. I went to sleep with gum in my mouth, and now there's gum in my hair. And when I got out of bed this morning, I tripped on the skateboard, and by mistake, I dropped my sweater in the sink while the water was running. And I could tell it was going to be a terrible, horrible, no good, very bad day. Now, this might be fine for a 4-year-old, but a kid who is delayed in speech and language, I counted it, 62 words. Way too much to comprehend. Way too much. They lose the whole train of thought. So though this book has some good ideas, and if you stopped and sort of talked about some of these, I went to sleep with gum in my mouth. We never do that,
No, of
right?
course
Because
not.
we didn't learn. And now there's gum in my hair, and you get real, like I do in speech therapy, real dramatic, and it's stuck in my hair, that would be bad. You could take and dissect this by being dramatic and kind of role-playing out some of this and said, it's going to be a bad day, and you would emphasize some of the key words. So you can take a book like that, but again, a child who only has 22 words, that was a lot of words, way too long. We don't ever write in sentences that are 62 words unless, you're writing for a magazine on a professional topic.
So we give parents and adults, grandparents, permission. You don't have to read every
do not.
word.
Look at, is it appropriate for where that child is? That's the whole thing. And like I said, you can always be a little higher than where the child is. But you have to figure out what your purpose is. Now, if you've got an older 4, 5, 6-year-old and you're wanting to fall asleep at night, and so you're just trying to read a story that they already know, you might read it because, the droning of your voice might put them to sleep. They already know the storyline, and you've already discussed all the pictures. And I think it is important to read dramatically so that I hear many a child read and they just run the sentences on. They don't drop the pitch at the end of the sentence. There's a lot we can learn about prosody and pitch.
What's prosody?
The speed at which you read something. Okay. And to stop at the end of a sentence, usually we go down a pitch. That's telling us it's the end of the sentence, like I just did. Okay. But when kids are reading, and then they went on, 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 I think I'll move to Australia, and then in the pool. They're just reading the words, and they're not reading kind of with the meaning.
And probably not really comprehending.
And not comprehending when they're so focused on reading. Poor readers are more like that. So if you, the parent or grandparent, read with expression and drama, not only will they get more excited about the story and stick with you, but they're learning how to be more expressive in their output, and not just sort of be boring speakers. Just the other thing I'll warn you about, this is not the best example, but I had this book, colorful and artistic. But when you're working with a child who is delayed and has limited number of words, you do not want to pick books that have pictures drawn by artists who are trying to make great pictures, because you can't tell anything that's going on in here. It's way too busy. Yeah. Now, if you have a 7 and 8-year-old that loves art, you can say how many mice can you find in that picture, but other than that, it is way too busy of a picture for a child who's trying to get concepts down. And
so you're using this book as this might not be the best type of book.
Right. Just make sure that just because it's a book that you find at a garage sale, which I get many of my things for therapy at garage sales, but pick up books that the pictures reflect what's going on. If you're talking about language delay, pick books that have realistic drawings, because if they don't know that word, some bizarre Picasso-like drawing of an elephant isn't really helpful to them forming the concept, and everything is concept development.
So having books that have real life pictures would be helpful.
Right.
And helping them with the concepts, learning what is this.
Right, exactly. I have different toys here. You can use anything to talk to your child. This is a good one. We'll just role play here for a second.
I get to be the little kid.
But when you buy objects for your grandkids, buy educationally good things. Now, a bear sort of has a different purpose. It's your friend. It's your snuggly. It can be there when you're sad. There's all kinds of purposes. And you can role play, you know, with two animals talking to one another. Let's have a picnic, and you know, you could kind of play. But this is a little bit more like teaching words. So for instance, blocks are very good for little kids that have very few words. They would say mama, dada, baby, doggy. They're not going to say in and out that much. So blocks are the best way. So then I'm going to just show you. Let's put the block in the box. Can you do that for me?
I get to be the young child.
Yes. Most kids would not say the word in as they do that, unless I had set that up for them. But that's right. You say, that's right, it's in the box. Okay, let's put it on the box. Good job, that's on the box. Okay, let's put this one here. Can you put this one on top? No, let's move this on top. 2 blocks. That one's on the bottom, that one's on the top. So there's 2 more vocabulary words. Now, put our block on top. Yeah. And what's that?
Star.
Star. That's up in the sky. We see those at nighttime. And why these blocks are good is because you could talk about every picture that's there. What kind of animal is that goes? What kind of animal is that? That's a horsey. Can you say horse?
Horse.
Good job, good job. I like the way you said that. All right, and that starts with the letter H. See, you wouldn't even really be doing that till they're at least 3. You might not get them to identify the letters, but you could always say it. It's just putting it in their brain so that when it's really worked on in preschool. Here's an animal. Look at that. You ever seen that animal in a book before?
No.
No. Well, that's a kangaroo. He lives far away in Australia. But look where the baby is.
Aww.
Yeah. The baby's right there in the mommy's pocket.
Hey.
And so they're playing together. And look at that. What animal's that? What animal's that? It looks like he's laying down. He's resting.
Oh, lion.
That's a lion. And most kids would say lion, and we'll talk about articulation in a minute. But that's right. If he says lion, then I would say, that's right, it's a lion. And I might exaggerate that. And you know what? That letter L stands for lion and light. Because we have a light in our bedroom, don't we? Yeah. So anyway, there's all kinds of things you can do, and of course you can get them to follow directions. Put this one inside. Is that one inside? No.
On.
That's too big. That's on top. That's right. Put it in.
Oh.
Put it in. Good job. Put that one in. Star. Another star. Uh-oh. And here's another one.
Ah.
What's that?
Oh.
Hop, hop, hop.
Ah.
What animal hops?
Rabbit.
Rabbit. Rabbit. Starts with the letter R. Rabbit. Okay. What is it? Tell me. You said it before. Tell me.
Star.
That's right. It's a star. Put it in. Last one. Put the block inside. Yeah, another star. 2 stars.
1, 2.
1, 2. 2 stars. Put it in. Good job.
Aww.
But I mean, there's many toys. This one is really the one I want to talk about. Kids that don't want to talk, kind of nonverbal, or very, very shy kids. Though this is kind of like a wand, but microphone. I have a kid that would not talk at all in therapy, and if I would say a word, even if it's not amplified, though mine is slightly amplified, and I would say, bear, your turn.
Bear.
Okay. Now, a kid who is imitative like she is, that means they're on the road to learning. But it's not usually that easy with a non-talker. They don't just immediately imitate every word you say. So sometimes you have to keep trying. This really works if you have a child that just wants you to do all of the talking and all of the getting of everything. They realize this is my turn. Bear. Your turn?
Bear.
Good job. Okay. Let's see. Airplane. I know it's a helicopter, but
Airplane. Plane.
Plane. That's right. It's an airplane. Your turn. Okay, my turn.
Ah.
I'll be your turn first. What is it?
Horse.
That's right. It's a horse. Anyway, this kind of reinforces turn taking, which kids, you know, don't always want to take turns. They want to be bossy and do everything and grab the mic and whatever. This is very good for turn taking, but it's also saying, I am talking now, you are talking now. I am talking now. And so if you have pictures, you know, it's very easy to do this. And they really think they're performing. And you say, you are on TV. You are talking into the microphone. Did you hear yourself? Say it again. You said that really good, you know. And you can use it. So this is just a fun object to find at a garage sale or go buy one of these.
And sometimes children will use that and talk,
Yes.
even though they might not talk
To,
to people.
yeah, aunt and uncle when they come over.
Yeah.
Exactly.
So it's a good thing to encourage the kids.
Yeah, now I think articulation is different. Let me just mention something about articulation. 70 to 80% of most speech therapists' caseload is articulation, because it is the most common problem, followed with language delay. But articulation is, kids may be great little talkers. They may know lots of words. They're very average in intelligence, and, you know, words and concepts are not their problem. They just aren't saying them clearly all the time. So some common type errors that young kids would have would be like saying a P for an F. Now, if you're a speech therapist, you know what all the common errors are. A parent may go, I can't believe he calls a fish a pish. Well, most kids, if they're going to make an error, do the P for the F. And when kids make an error, they do the T for the S. And when they make an error with a CH, they do an SH. There's just very predictable substitutions, which are easier sounds to produce than the harder ones. So for instance, if the kid, child.
It's okay.
Yeah, it's okay.
We all call them.
We work with them all the time. If they're saying pish, the P sound is very easy to make, and it's one of those early developing sounds, but they have not generalized it to that word. Because they might say papa or puppy, but not do it in fish. You know, I mean, so that you know they can do the P sound. The F sound, though, is harder because you have to take your top teeth and bite your lower lip. And of course, I'm showing them at the time. And blow air. So you can, with some practice, get a child to do that. And they have to kind of think that top teeth going to the bottom. And if you show them a mirror, they can see themselves doing that. And that's like, oh, that's good. So let's make that sound. So you practice it, you know they can make it. Then you show them a picture of a fish, and they'll go, pish, even though you've practiced the F. So then you say, no, we have to say it in this word. So let's try it again. So you go, ish.
Ish.
Okay, but what most kids would do, they would do pish. That P is still in there because in their brain, that is the word. They know that it's a thing that swims, and they know exactly what a fish is. But in their brain, it's very programmed, conditioned in that the word is. So they will do, and then they say pish. So here's the trick to get rid of this, because this is very common. And it frustrates some others, and then they know, I just can't do this. You take the word and divide it into two parts. Sometimes I have objects, but I don't have anything here, so I'm going to take your two hands.
Okay.
You say, we're going to make this word into two parts. Say, ish.
Ish.
Ish. Ish. Ish. Ish. Now say it all together. Fish. Fish. Right. If you break it into two parts, you said no, you said pish. You put the P in there. You have to get them to break the word and go straight to the vowel. And sometimes if they don't get it, you start with the second half of the word. Just say ish.
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 That's right. So that's kind of like called backward chaining. And if they have it so in their mind that it's pish, you have to almost make it a non-word. Take the latter half. So the same thing works with S's are very common errors. And most kids will say the T, because the T is very easy to do. Right behind the alveolar ridge or the back part of the teeth. But the S is also very easy to make, but they will say ton for sun. Look up at the ton. The ton is in the tie. Okay? So, of course, you're going to teach them how to do the S sound, which is close your teeth and make the sound of a snake. And with boys, you need the motor responses. So, you do the same thing. They'd go, ton. So you say, I don't want ton, I want un.
Un.
Say un.
Un.
Un, un.
Un.
Good job. I love the way you said that. And always reinforce the good efforts. And then you might say, and I sometimes hold my hand up, because when you're working on speech, guess what? For 5 years, they've said this word wrong. You want to know how many opportunities that's embedded in the brain? So me just doing it one time is not going to change that habit. Now, the brain is better than us working with us with bad habits that we find hard to break. But it is still a habit pattern that the brain has learned. So you have to break that by putting over something that is new. And so you want to practice that word as many times. You can put them on the refrigerator, you can play cards, you can get these alphabet books that have the 10 S words that are on there. So we're going to go soap, sun. Find S words that then are followed with a vowel. You will get your child to learn that sound much better. Okay. And you would start at the beginning. Then once they have said the S at the beginning of words, then you teach it at the end, because that is harder for most kids. There's a few kids that have it at the end and don't have it at the beginning, but the average kid would not have it any place. So you teach at the beginning, then at the end. Then, like the word pencil, where the S sound is in the middle. That is the hardest, because you have consonants before it. You have to put in this new motor movement to make this sound in the right place. And then you can't just stop there. You have to continue on with the word. And all of this is in half a millisecond. Pencil. half a second. So to do it motorically, it is hard.
We want to encourage adults, please, the younger that you can do these things with children, the better it is for them. As Barb was saying, it gets embedded in their brains, and so you have to help them to unlearn a pattern that they have developed and then help them to learn the correct way. I like to encourage parents, think of the child doing this 10 years from now. Maybe when they're 2 or 3, we think it's cute. But when they're 12 and they're still doing it, it's not cute. It's a major problem for them. I also need to tell Barb, we only have a few more minutes. And I have to ask you to come back so we can do these other things.
I wanted to talk on autism and a bunch of other disorders, but I guess we'll have to save that for another
We'll save that for another time.
If a mother is concerned or a grandparent is concerned, you can ask your pediatrician. Now, they know general information, and they know a lot about the different kinds of disorders. With stuttering, I have found that many times pediatricians will tell parents they'll just outgrow it. Well, I have a whole profession based around that kids will not outgrow everything. So that's the only thing to be leery of a little with pediatricians sometimes, is saying that everything's going to be outgrown. Intervene anyway, and if they catch it, then it's a learned skill. The other thing is here in Athens, there is a speech and hearing clinic. And if you have any concerns that you want an evaluation and, the doctor just says, well, let's just keep watching it. That may be true. You can watch it for a while, get some good advice. But if you want a full evaluation, the best thing to do is call OU Hearing and Speech Clinic, because they can check your child's hearing, make sure hearing's going on, and they do wonderful speech and language evaluations. The students, want to be exposed to the different kinds of learning issues that a child may have, and it's a good service in the community, and it's very local, and I would go ahead and get referred, and if they don't think the child needs therapy per se, they might at least give you suggestions for things to do at home.
That sounds good. So to kind of wrap up on some of the resources that are available, you can call 211 and get information about what's out there. Help Me Grow, OU Speech and Hearing Clinic,
Local Head Starts.
Local Head Start. So please, the younger you can help a child, the better it is for them. Barb, I want to thank you very much for coming today. Thank you.